The Dialectical Behavior Therapy Skills Workbook, a self-help guide to overcoming PTSD. Reduce your stress with DBT techniques and practical exercises for learning mindfulness and more. Written by William Gallant. Narrated by George Johnson. Chapter 1. Dialectical Behavior Therapy. Introduction. Dialectical Behavior Therapy, DBT, is a proof-based psychotherapy that started with endeavors to treat marginal character issues, otherwise called emotional instability disorder. DBT has been proven by whom? Valuable in treating disposition issue, self-destructive ideation, and for change in personal conduct standards, for example, self-damage and substance misuse. DBT advanced into the process in which the specialist and customer work with acknowledgement and change-arranged methodologies, and eventually adjust and incorporate them in a way equivalent to the philosophical argumentative procedure of speculation and absolute opposite, trailed by blend. Dialectical Behavior Therapy, DBT, treatment is a sort of psychotherapy, or talk treatment, that uses an intellectual social methodology. DBT underlies the psychosocial parts of treatment. Self-destructive lady Marsha Linehan sifted through the writing on reliable psychosocial medications for different issues, for example, nervousness issues, sorrow, and other feeling-related challenges, and gathered a bundle of proof-based intellectual social intercessions that legitimately focused on self-destructive conduct. At first, these mediations were so centered around changing insights and practices that numerous patients felt censured, misconstrued, and refuted, and thus dropped out of treatment by and large. Through an exchange of science and practice, clinical encounters with multi-problematic, self-destructive patients started further research and treatment advancement. Most strikingly, Linehan meshed into the treatment intercessions intended to pass on the acknowledgement of the patient and to enable the patient to acknowledge herself, her feelings, musings, the world, and others. In that capacity, DBT stopped on an establishment of an effective way of thinking, whereby specialists endeavor to adjust and integrate acknowledgement and change-situated methodologies consistently. At last, this work resulted in an exhaustive proof-based psychological conduct treatment for marginal character issues, BPD. The standard DBT treatment bundle compromises week-by-week singular treatment sessions, roughly 60 minutes, a week-after-week bunch abilities instructional course, around 1.5 to 2.5 hours, and an advisor council group meeting, approximately 1 to 2 hours. At present, 8 distributed, well-controlled, randomized clinical preliminaries, RCTs, have shown that DBT is an effective and specific treatment for BPD and related issues. This article features a few critical parts of DBT and is sorted out around focal inquiries that experts may have in choosing whether and how to execute the treatment. In this manner, this article fundamentally features parts of the hypothesis and practice of DBT that set this treatment apart from different methodologies, which the reasonable patient populaces are, and essential and remarkable components of DBT that must be set up for some random patients. The theory behind the methodology is that a few people are inclined to respond in an increasingly unusual
Sample complete. Ready to continue?